Depending on who you ask, creating a system to drug test welfare applicants is seen as either a way to demonize the poor or a means to restore dignity. The latter argument is winning out in the 83rd legislature, with lawmakers in both chambers advancing bills to implement new requirements for Texans receiving unemployment benefits or support from the Temporary Assistance for Needy Families program, or TANF. John COLYANDRO with the Texas Conservative Coalition has testified in favor of Senator Jane Nelson's SB 11.
It runs so fundamentally contrary to the nature of the programs to say that the drug abuse or drug use while on those programs ought to be tolerated.
Nelson's bill, which would require adults receiving TANF benefits to submit to a drug screening questionnaire and, if deemed necessary, a drug test, has gotten the most traction. It passed out of committee with bipartisan support after Nelson agreed to add a protective payee provision, allowing Health and Human Services to designate someone to receive the benefits on a child's behalf if the parent tests positive for drugs. That payee would also be subject to a drug test. COLYANDRO is among those who believe similar language will be added to the House versions.
Hopefully through the continuum here that we begin to lessen the use of illicit drugs for the purposes of helping people get on their feet, remain independent, and then ultimately not receive other types of public benefits.
Sue MILAM heads up governmental relations for the Texas chapter of the National Association of Social Workers, which is against drug testing both TANF and unemployment benefit applicants.
It seems like a huge waste of taxpayer money, money that could be spent on the benefits people receive as opposed to testing all of these possible recipients for finding just a handful that would not qualify.
According to Texas Health and Human Services, each drug test will cost $35. After operating and testing costs, the Legislative Budget Board actually estimates that SB 11 will have a $1.2 million negative impact on general revenue funds for at least the first 2 years.
We feel that it's a dehumanizing process, and we feel that there is no rational reason why they should be tested above any other particular group receiving any other kind of federal or state benefit.
This session, though, there is more interest than ever to make drug testing welfare applicants a reality. Reporting at the Capitol, this is ALANA ROCHA with the Texas Tribune.